I'm going to do another talk on the drug management of diabetes. And there are two main arms of management of diabetes in diabetic patients. One is the oral drugs that help to lower the blood sugar, and the insulin, which is used. On the oral anti-diabetic agents, we have various classes that are used, and they work in several mechanisms. Some drugs like the biguanides, where metformin is one of the main drugs, they work by decreasing the production of glucose by the liver and also increasing the insulin sensitivity. Then you have drugs we call sulfonylureas. The commonest is glibenclamide, glimepiride, which help to stimulate the beta cells to produce more insulin. Then you have the non-sulfonylureas, which act in various ways. We have the alpha glucosidase inhibitors, and then we also have another class of antidiabetic class called thiazolidinediones. So the drugs that target insulin secretion, they increase the secretion of insulin by the beta cells, include the sulfonylureas, the meglitinides. Those two groups, they increase the secretion of insulin. Then there are those that target insulin resistance. I've talked about the biguanides, which act on the muscles and also the peripheral tissues, and also the thiazolidinediones, which act on muscle cells to increase their sensitivity to insulin and also insulin uptake. There are those drugs that target glucose absorption from the intestines, and the main group there is the oral glucosidase inhibitors. So the biguanides, as I've said, the main drug is metformin, which inhibits the production of glucose by the liver. Then we have talked about the sulfonylureas, example being glimepiride, glipizide, and glypiride, which increase the secretion of insulin by the pancreatic cells. Then you have the meglitinides, which increase the insulin secretion by the pancreatic beta cells. The thiazolidinediones, the main example here is pioglitazone, and they work by increasing the glucose uptake by the skeletal muscle. Then you have the alpha glucosidase inhibitors, and they inhibit the carbohydrate absorption in the small intestine. Then we have insulin. Insulin is used both in type 1 and type 2. In type 1 diabetes, insulin is the absolute drug, because this individual with type 1 diabetes, they have no insulin of their own, and so they need insulin replacement. And so the patients will find that the occurrence is usually less than 30 years, and also we also use insulin in acute conditions of type 2 diabetes, like patients who have acute infection, patients who present with acute complication of diabetes, and of course those patients with type 2 diabetes where the oral hypoglycemic drugs have failed to work. So in the use of insulin in type 1 diabetes, there are various types of insulin that are used. There is the short-acting insulin, there is the long-acting, and the indication are dependent on the various factors we have said about the patient, and you need to take care of the meal plan of the patient and also the capacity of the patient to monitor his or her glucose levels. So in the management of type 2 diabetes, you need to consider the first thing that is very important is the diet and also the lifestyle modification. That is the first level, because you realize in patients with the type 2 diabetes, most of them are overweight or obese. So you need really to take into consideration the issues of weight. Then exercise, and then at the third level is medication. So then we also need to treat other associated conditions, especially in type 2 diabetes. Patients will have cholesterol problems, they may have problems with hypertension, they may have problems with obesity, and they may also have coronary artery diseases. So you need to screen for these complications and manage them. then you also need to screen for the complication of diabetes. As you realize, type 2 diabetes is a slowly presenting condition, and so patients will have problems with retinopathy, they may have cardiovascular problems, they may have kidney problems, they may have complication of their nerves, and they may have other complications from other diseases that are associated with the metabolic problem. So there's need for a stepwise management in type 2 diabetes. You start with diet and exercise. Then after that, you can start with one drug and build up as necessary. If the one drug is not working, then you can do combination therapy. And if that does not work, then that therefore would be insulin and the oral agent. So in the education of patients with diabetes, what are we targeting? First of all, patients should understand very well about diabetes. Then they need to know what are you doing to manage the sugar. What dietary requirements do they have? They also need to know exercise. Then the use of drugs, they need to know the types of drugs they are using. They need to know the side effects of the drugs that they are using. And they also need to know the complications of diabetes. They need to know and understand about food care and also adherence to treatment and the follow-up. And then, very important, which patients should be aware of, is the signs of low sugars. Because this is a common occurrence when patients are on treatment, especially with insulin and also some of the oral hypoglycemic agents. And some of these symptoms include the patients get tired, excessively hungry, they feel very weak, they may start sweating, and they can also lose consciousness. So anybody who is living with a patient with diabetes should be able to identify hypoglycemia and also take the necessary precautions as soon as possible.